So in this video we are going to talk about the special test for the cervical spine. In my previous video I talked about the special test for the cervical spine that check the strength of the cervical muscles or the endurance of the cervical muscles. In this video I'm starting the neurological examination for the cervical test, or the special test for the cervical spine that assesses the nerve tissue or all the neurological tissues. This special tests for the cervical spine are provocating in nature. They reproduce the pain or the symptoms one more time. Just exception is the distraction test. Now, the special test for the cervical spine that check the neurological tissue will focus on mainly on three things. First, spinal cord, brachial plexus, and radiculopathy. Now, the special test for the cervical spine will check the pathology, but they don't tell you where the pathology is exactly originating from. The pathology can be originating from either trauma or degenerative disorder or anatomic anomalies. And also don't forget the unusual things can affect the nerves like tumor, infection, rheumatological issues, or the vascular insufficiencies. Now, some of the tests for the cervical spine are called as a neurodynamic test because these tests are sensitive to the movement of the nerves in the cervical spine, to either the movement or the tension applied to the nerves. So in other words, also you can say that these are neurologic mechanosensitivity tests. Now, how examiner can come to a conclusion that particular test for the cervical spine is positive? But just by four things. First, is reproduction of the pain or the same symptoms one more time. Second, asymmetric sensation between the left and right upper extremity. Third, significant deviation from the normal sensation from the patient. And fourth, sensitizing movement will change the pain and the sensation. Sensitizing movement, that I'll talk more in my coming video when I'll talk about upper limb tension test. So what's the sensitizing movements? You apply more traction or more extension to the wrist and you reproduce the symptoms one more time. In this video I'm going to talk about just two tests. First is a brachial plexus compression test. Now, brachial plexus compression test you perform after any mechanical lesion to the cervical spine, where patient is in a sitting position. Examiner applies firm pressure with thumb and index finger to the brachial point. Now, pain at that particular point is not diagnostic in nature, but radiating pain into shoulder and upper extremities. That means the test is positive. So that is brachial plexus compression test. Coming next is the distraction test. The second one, distraction test, or in other words, axial manual traction test for the cervical spine. Now, this test is performed if the patient has a radicular symptoms in the upper extremity. As I said earlier, all the tests are provocative in nature, but just the distraction test will alleviate the symptoms. Now, this test is performed when the patient is in a supine lying position. Examiner applies traction force, one hand put on the chin and the other hand on the occiput, and examiner applies a firm traction. And the symptoms are alleviated. That means that the test is positive, where the pressure on the nerve root or nerve is alleviated. Now, sometimes pain can be reproduced in the distraction test. That means the patient has ligament sprain, muscle strain, or sometimes the neural irritability. During the distraction test, if the patient abducts the shoulder and still the signs and symptoms are reducing or lessen, that means that C4, C5 nerve root is involved. In my coming video, we are going to talk more about foraminal compression test, opposite to the distraction test, Sperling's test, and upper limb tension test, ULTT. Thank you.